Hey, good afternoon, everybody. Eric with American Business Systems. I hope that you are doing well on this Wednesday afternoon and looking forward to our topic today, top reasons a doctor should be outsourcing their billing. We're going to be going through all of that this afternoon. So I look forward to spending the next hour with you. It will go quickly. I'll tell you that. It always seems like it, when we first of all say, gosh, a whole hour on a webinar. Yes, even if it takes us a full hour. But what I'd like to do is make sure, again, that you're getting your questions answered on these webinars and that we give you all the information that we can give you. I appreciate everybody that joined us last Wednesday. If you missed last Wednesday's webinar, you missed a good one because it was with Opie. She is doing incredibly well in her new business. And so if you have not gotten a chance to see her interview from last Wednesday, I certainly encourage you to go do that. We've got a couple of other interviews I'm going to share with you at the end of today's presentation. So don't hang up too quickly if you don't see the upcoming schedule of the webinars that are coming up. I'll have my last slide kind of goes over that. We'll kind of talk through some of that. But I'm just waiting for a few more folks to show up here. It's good to see Sherry again. I think we've seen you on here often. Latanya, I see that you're back on here again. Thank you for joining us. Panam, it's good to see you. Shruthi or Shruthi. Hopefully, again, I said your name correctly. So feel free to correct me if I need to. In just a second, I'm going to be asking you to go over to the question and answer box right over here. Just tell me a little bit of something about yourself, or just tell me where you're located. Would be wonderful news for me to help as we kind of go through here today. So again, find that Q&A box, because this is also going to serve as the place where you're going to ask questions to me throughout the presentation. So you'll see this pop up here ever so often throughout the presentation, and that is to engage you. I want you to be engaged in the webinar today. It's always fun, and it's more interactive when we've got questions that are coming in, whether it's on the topic that we're talking about right now, or if it's on a different topic. And if I can too, I will certainly be able to open up those questions and help you out with it. So Panam's from Maryland. I appreciate that. First one to answer my question there. So at least I know I'm being heard. So maybe Ken Kingsley, if you can add in here where you are from today, and Latanya, and the rest of you here that are on this afternoon. So why don't you do that for me? Again, that's just in the Q&A box right there. Find that Q&A box and then just type in the city or the state that you're located from. I would appreciate it. For those that are first timers on here, my name is Eric Auger. Let me tell you a little bit about myself. I've been around with ABS now for over 18 years. I started with them whenever Patrick was here, and we were doing a lot of training, and I had just quickly come out of a training consulting background, and so this was really a good fit for me to kind of get stationed at one place for quite some time. And I've been with this family, for the Phillips family, like I said, for a little over 18 years. It's a pleasure and an honor to serve, continue to keep serving those that have invested so much into me, like Patrick and Adam and the rest of the team here. So I appreciate each one of them. Speaking of Adam, Adam is our CEO. He took over a few years back before his dad stepped away from the business. Adam is now the CEO. If you've never talked with Adam, you get opportunities to do that on some of our webinars. Matter of fact, coming at the last part of June, you'll be able to do that, as you'll see there on the calendar coming up. But he's always available. That's one of the great things about Adam. It was always great about that with Patrick. As CEOs and owners of the company, they are always available and have always been available for you to chat with them. So you can always reach out to Adam and have a discussion with him if you're not already talking with him. Adam's written a couple of books here. I've showcased this one. The reason I showcased this one is because in a couple of weeks, I'm going to be actually interviewing the other author of the book, which is Dr. Vicki Rackner. Now, today we're talking about top reasons a doctor would want to outsource their billing. It's one thing to hear it from a academic, a business model, but it's going to be so different whenever you hear it from Dr. Vicki Rackner. So today we're kind of academic, okay, if you want to think of it that way, and we're also, from that market analysis research part of, top reasons a doctor should outsource their billing. So you're going to see some quotes, some news articles that I'm going to send you on so you can go check out yourself. But Dr. Rackner is going to be on with us. Anyway, Adam and Dr. Rackner co-wrote a book together, 9 Ways Doctors Let Money Slip Through Their Fingers. So you might want to get a copy of that. Adam's also been featured in a new group or a new article here through Healthcare Business Review. You can ask for a copy of this from your sales rep. Now, there'll be several times I will be kind of directing you back to the person that you're talking with here at American Business Systems to get some information. This is one of them. Adam read a great article, The Blueprint for Building a Successful Medical Billing Business. It's all from the standpoint of basically where you're coming from. So if you want to get a hold of that, and they also awarded American Business System as the top medical billing business support service in 2026. So you can see the certification that we got from them. Adam is also featured in some articles in a magazine called Billing and Coding Advantage magazine. He's written a few. He's got a couple more that I know that will be coming out between now and the third quarter of this year. If you can already believe that we're already almost done with the second quarter of this year already. How many folks, can you believe that just next Monday is June the 1st? It's just unbelievable how quickly time's going on, and then we'll get through with June and we'll already be halfway through the year. We're already going to start looking at things to look forward to in the fall and in the winter and all the holidays that come with that. It just goes by so quickly. But getting back to our articles, you can get these articles again directly from your sales rep. You're not going to want to miss this one here. It's probably one of the key ones that keeps one of the highest requested articles that Adam's done. And that is the advancement of artificial intelligence. Is it going to take away my job as a medical biller or a medical coder here? So you're not going to want to miss that. He is also the founder of an organization called MIRMA. MIRMA is the Medical Revenue Management Association of America. It is this group here that will certify you. Once you're certified, you get to carry their logo on all of your marketing material, your business card, on your website, anything where you want to be able to place that, you can. Because now at that point, you'll be an associate of MIRMA as one of their colleagues there. So you're going to want to be a part of that as quickly as possible. All right, so we've kind of gotten through. I always like to make sure that I give us a good 4 or 5 minutes. It lets people still kind of get in who are getting off of work or just getting dialed in. We got a great audience here. Godfrey, it's good to see you. Kelly, Kishore, it's good to see you. So again, if y'all don't mind, if you want to pipe in there, just kind of tell me where you're located. I would appreciate it. Remember, again, that audience question box is going to be popping up here throughout the presentation. All right, so let's get this thing kicked off. So today, everybody joined in today because you want to know what are the top reasons a doctor should outsource their billing. Well, first of all, before we start spouting off some of the reasons why we think we ought to, we need to look at some of the issues that doctors are facing, and is there a growth in this industry? Obviously, you're going to be investing in it. It's a $35,000 investment. We know that's not just pocket change for all of us here, and we know that it's going to take an investment to get things going. The great news about it is, as I'll share a little bit towards the end, that typically, as we even heard with Opie last Wednesday, that she's already recovered all of her investment, plus she's doing extremely well and getting ready to bring on even more doctors here. So it's pretty incredible what you can do with just one doctor as a return. Kishore, it's good to see you. Thank you for piping in there. You're calling in from Chicago, so I appreciate that. All right, so what we're going to do, first of all, I did a little market research. I always kind of like to do, a little, what's the temperature out there? What's kind of going on? And you'll see here that at the bottom of all of my slides, now, if you can't read all of these, because some of them are kind of small print, you can request, again, from your sales rep, a slide deck of this. They'll send you a PDF of these slides, so if you'd like, or if you'd like to, at any time during the presentation today, you can certainly take a screenshot of anything I've got up here. Nothing's copyrighted to where we can't share it or anything. But medical billing outsourcing market. So this is from Fortune Business Insight. Fortunately, they had a really nice looking graphic here. It's kind of helps shows how they've kind of looked at things. So historical periods from 2021 to 2023, you can see a little bit of information from there. This is based on year 2025, so you can kind of see as this thing is growing through here. And its forecasted period is from 2026 to 2034. Okay. What you're looking at here is a 12% annual growth rate. Okay. That's what you're looking at there. So if anybody knows anything about percentages, anything about how this is growing, you can see that every year it's growing at least 1% every single month, and it's just not stopping. It's huge. The market is just incredibly, and this is, as you can see there, this is looking at North America medical billing outsourcing market size. So it is huge out there, and it's still growing. You can see in 2025 it was priced at $18.2 billion. In 2026 it's looking like it's going to be $20.3 billion. The total U.S. billing in America, which is including now, hospital billing and all of that, you were just talking 50 billion dollars out there. So there's a lot of money that's going and exchanging out there in the marketplace. So as just an entrepreneur, and you're looking for a business opportunity, obviously you want to see, is there growth? Now, again, I'm going to pause this here again just to remind you here, because a lot of people are thinking, well, again, what about the onset of artificial intelligence? Again, that's why I'm going to keep going back to you and say, hey, you might want to read this article here. Plus, I did a deep dive not too long ago on a webinar showing the benefit of artificial intelligence right now. And you're actually hearing that. You can even hear that through Opie's interview last week and some other interviews that has shared that we see artificial intelligence as a huge, huge help in medical billing, especially for those that are just getting started in medical billing for yourself as an entrepreneur. There are so many people that are so creative with reporting now. They can do such wonderful, analytics with AI, and it's just amazing what you can be able to do. Another resource that we like to use is a group called Global Newswire. And again, they are, you can see here that in 2025, they had it forecasted at $6.9 billion. And in 2023, it's going to reach up over $18 billion. Again, their graded annual growth rate there, as you can see, is still at 12.6. So it's pretty much the same as you kind of look through that. And another little part here is always, let's look at the AAMA, or the AMA, and this is the American Medical Association group. And so what I have found from them in this particular article is physicians and their staff spend an average of 13 hours per week on prior authorizations done. So what you're going to want to do is read this article. You can go directly to that article there. And folks, what you're going to want to you find there is that this is pretty important information as you are getting, it is, number one, is there a market? And then obviously, is there a need? And so this is just one aspect of billing that is, as when you read this article, that is just eating up the doctor's time, and it's not getting them anywhere too much quicker. So you can see down there, the source is the AMA surveyed 1,000 physicians conducted in late 2024. And a lot of these market research data always lags behind about anywhere from 12 to 16 months whenever all kind of shakes out here. So that's why we're finally getting some of this information out. Findings include practices complete 39 prior authorizations requests per physician per week, with physicians and their staff spending an average of 13 hours completing those requests each week. That's not even seeing patients. That's not even billing out. That's just making sure that patients can at least be seen by the doctor, and those insurances actually will pay. That's what pre-authorization does. We want to make sure, the doctor wants to make sure, and you as a medical billing company is obviously, if you're going to do the billing for that patient, for that doctor, you're going to want to make sure that when you process a claim for that patient, for that doctor, that the doctor's going to want to get paid. And a lot of times you can avoid a lot of issues that come up with whenever the patient doesn't have insurance, or it's been expired and you find out that they're with a different program or a different insurance group. So anyway, those are some of the things. So we kind of went over a little market research. So first of all, for yourself, you can see that there is a major growth coming in. It's still a good growth. I don't think artificial intelligence is going to take anything away. Feel free to ask me a question if you got any questions about artificial intelligence and medical billing. I'll do my best to kind of answer your question here, but that's it. So now we're going to go over some top reasons here, and I kind of carved out what I kind of call the top 5 reasons here, and I'll start that here real quickly. Kelly, thank you for telling me that you calling in from Raleigh, North Carolina. Thank you so much. Appreciate that. All right, so if you got your pens and paper out, or if you want to just wait till all 5 of these pop up at one time and then you can do a screenshot, that's fine too. Number 1 is cost savings. Okay, whenever doctors are doing anything, it's just like any of us. I mean, don't we all shop for different homeowners insurance, or every year we're looking to shop for different car insurance? We always want to find cost savings. Is there something we can do? Prices keep going up. So what do we all try to do? We try to see what we can do to reduce our costs so that we can maintain possibly the level of lifestyles that we're all accustomed to. So we make those adjustments. And so the doctors make adjustments through that. And so one of the things that you'll see here in a moment is one of the top reasons for a doctor to outsource is the billing. And it might surprise you, is there's a lot of cost savings that go along with that. Number 2 is staffing challenges. If anybody has ever been in business ever, and you're an owner of a business, you know, or you've been a leader or a manager or a director within your company, you know that staffing challenges always occur. You feel like you get the right type of people, you hire the right people, and all of a sudden, for another dollar or $1.50, they leave you, and then they go somewhere else, and then you got to retrain. That happens a lot with doctors and medical billers. Medical billers don't stay in one place very often within a doctor's office, unless it's like a family member. And usually at that point, that family member is looking for a way out themselves. They're tired of doing the billing for the doctors. So that's another top reason why doctors would be looking to outsource their billing. The third one is compliance burdens. I'm going to share a little bit about that today. Now, I can't go into much detail, but if you'll get back with your sales rep, we've got one service that's called Compliancy Guard that I would suggest that you really take a deep dive when you get with your sales rep again. It's called Compliancy Guard. And it's a wonderful, wonderful service that you will have at your disposal for your doctors. Okay, and so you can take that compliancy burden off of it, and that's one of the things that we'll talk a little bit about today. The other thing of penalties and clawbacks, I'm going to talk to you what a clawback is when we get there. And then lastly is technology in and of itself. Believe me, you know, doctors are looking forward to this whole thing of AI. I think doctors now are adapting a lot more towards technology because more doctors that are coming into this have kind of grown up in the computer age and I would almost kind of date myself if I say the Walkman age, but that's kind of past. That was whenever you had the little cassettes with the little earphones on, now we've got iPads and iPods, and now we can listen to music from our watches and everything. So we've come a long way technology wise, and healthcare has done the very same thing. All right, before we get into the cost savings, I want to share with you another article that I found here, and it's out of the Business Wire group again, businesswire.com. I've got their URL down there below. Again, this comes from another data set out of 2024. Again, like I mentioned, a lot of this data information culminates over a 12 to 16 month period. So we're right in smack dab of all of this, but this was posted just back May of last year. So this is good, still good data. But claim denials are rising and costing practices real money. That's the information in the part of the article that's here. But let me just kind of give you can see here the rate of initial denials of medical insurance claims continued to rise in 2024. Kodiak Solutions proprietary data shows this information. Okay. So what they said here is what they found is the initial claim denial rate hit 11.81% in 2024. That was up from the previous year by 2.4%. So if it's gone up in 2024 and it's gone up probably, let's just say another 2% here, it won't be long until whenever claim denial rates are going to be hitting 14, 15% here pretty quickly. And this was a survey that was done out of over 300,000 physicians. Now, we're not talking hospitals. We're talking about the people that you would be doing the billing for. So our denial rate is less than 2%. So let that figure in what you're able and capable of doing. Say a doctor is at 8, 9, 10, 12% rejection rates or claim denial rates, and you're able to get it back way down in the small single digits area. You think the doctors would think that you've hung the moon, because that's where their money gets tied up. If you think of it as a kinked hose, a kinked water hose, everybody's have a garden hose, and you go to turn it on out there, and you want it to come on out, and you have to kind of unravel everything, just knowing that you got a kink in it, and it's just because it's that kink is there, you're not getting the full flow of the water. Well, it's the same thing with these medical claims. If there's a small kink in anything, if kind of go back between this and what I shared with you earlier, when doctors are spending 13, 14, 15 hours a week, just making sure that they're going to get paid just doing pre-authorizations or prior authorizations. So that's a lot of time that's dedicated, that if they just outsource that out to somebody specialist that can get that done because they know how to do it, somebody like yourself, and get it done quickly, then it's a huge win for them. Obviously, it's a win for you. All right, so let's talk about this first cost savings. Okay, so typically, if a doctor will outsource their billing, their immediate impact on their bottom line could be anywhere from 30 to 40%. I put 35% in there, just kind of split the difference there. And where does that come from? Well, it comes from they no longer have a full-time employee. They don't have to pay Social Security taxes. They don't have to pay insurance. They don't have to pay for PTO. They don't have to pay for any other things and training that they have to spend time on. Probably spent money on recruiting and all the other things that go along with just having a full-time employee. Get that out of their office, and either for the same or less amount of what it would cost the doctors to outsource their billing, they're going to get an outsourced billing company. But the difference is that the income return of getting it outside the office increases, it would increase. The revenue increases because you're going from 11% denial rates down to 2% denial rates. You get that. So you got a 9-point difference there of getting more money into that doctor's office. We have a whole spreadsheet and a what's called a practice analysis worksheet that will help you show the doctor, look, this is where you are, possibly even with your full-time employee. This is what it would cost you for us to do your billing, but this is the outcome. So we've already got that built out. Again, if you haven't seen that practice analysis kind of played out there, get back with your sales rep. So again, I know I'm kind of speaking fast. We're almost at the bottom of the hour already. But if you want to, again, if you've got your pen, you want to take a quick little piece of paper here, taking notes here, get back again with your sales rep and ask them to show you the practice analysis worksheet, okay? And then the results that come out with it. There's a practice analysis report that comes out with it. That thing, quote unquote, bottom line, sells itself. Because whenever you're showing that you can bring in another 20, 25% more money a month for a doctor's practice just by doing some of the simple things, you've got a great platform to close a deal. Berenda, it's good to see you from Maryland. Thank you for piping in for there. All right, so 30 to 35% operational cost reductions just getting outsourced. Again, here we go. Here's the collection rate. Collection rates again out there can be, in the 75 to 60% range sometimes. But if they outsource, this can achieve anywhere from 90 to 95%. I tell you, we're at 98% versus what's typically done in houses for collection rates, which is about 85%, and they can't really get any higher than that. So when it costs them more to have an employee and they're not getting everything that they should be getting, obviously the doctor's losing money. That's what that practice analysis worksheet will show forth to them and kind of get that to them. And obviously they're going to have an annual savings. That annual savings for a small practice could be almost as high as $365,000 a year. That's when we add in again the recovered revenue from that they weren't getting to having a full-time employee in the office, combined with the reduction of claims that are being denied. It can be as high as that pretty easily. And then the hidden cost, practices lose 25 to 30% potential income just due to improper billing. So all right, so I'm going to stay right here for a second here. If you want to take a screenshot of that, you certainly can. This is only number one of 5 reasons that we're kind of just going to go over here. I've got one more great piece of information from another group, another market analysis outsource reporting group. But if you want to take a screenshot of that, take that, and then we're going to move on to the next slide. Unless there's any questions. Again, I want to make sure that if you've got any questions, I don't want to go by too quickly today. Yeah, I know these topics it's very educational, very, to help you understand everything. So if you got any questions, feel free to stop me and ask me. Okay. All right. Before we get to number 2, look at this. This is from Market Analysis Report. This is called from grandviewresearch.com. Industry analysis, U.S. medical billing outsource market. Okay, so I just took a quick screenshot. This is a screenshot of their top page there. This is U.S. medical billing outsource marketing from 2026 to 2033. Okay. Again, you can see how large revenue shares are in 2025. But look at this highlighted line. Many hospitals and independent physicians prefer outsourcing these services to reduce healthcare costs, increase profit margins, and improve patient-physician relationships. If there's anything that can help you understand, there are marketing companies out there who do a lot of surveys for doctors. This is one of them, and we use them quite often just to kind of get you some more information out there. So if you want to just take a screenshot of that, or again, if you want to get the entire slide deck, again, get back with your sales rep by tomorrow, and we can have this all in a PDF and emailed out to you. Okay. But again, this is just a great quote here that is non-American business system. This is out there with people that have money to spend on doing surveys. You can see here that this is a very good help for you. Okay, let's move to number 2, staffing challenges. Okay, so there's 3 areas here that we're gonna deal with whenever it comes to staffing challenges that creates headaches for every doctor out there. Okay, all right. So 33% annual turnover in billing support roles creates constant disruption. That happens quite often in doctors' offices. As I said, I've looked at resumes for doctors' offices. I look at resumes for my own business in healthcare. And sometimes I see people that have been in a doctor's office for 6 months, 8 months, maybe 12 months at the most in billing, and they're on to the next one because they are looking for themselves. How much more money can I make? I got experience over here with Dr. A. Now I can market myself to Dr. B. And whenever Dr. B is putting out a post on Indeed and saying, "Hey, we're looking for a medical biller," maybe I can market myself a little bit more. Instead of making $20 an hour, I can make myself $21 an hour. So that's what happens in the industry. Let's see. The number 2 is, let's look at number 2 here real quickly. Lengthy recruitment. It takes really to fill a gap. I know this for personal experience, and these are this might be a little bit high, but I mean, a good 60 to 30 days or 30 to 60 days can disrupt a doctor's office immediately. If a medical biller ups and quits and gives a what's supposed to be a 2 week notice, it doesn't give the doctor hardly any time to try to fill that. And so many times they're trying to find a temp agency. Now, I hope you heard what I just said. Many times when doctors lose their medical biller, they're looking for some type of temporary agency to help them. Hope that was a clue for you, because let me share what we've been able to do. We teach that one of the ways to look for doctors that are looking for a medical biller, and that is whenever the doctors post things on Indeed. We're going to show you how to use some of those postings to hopefully get your foot in the door, and you might even catch a doctor there and do their billing without them having to hire a full-time employee. Kishore says, oh, my first encounter with ABS was the ABS life cycle with a claim. Oh my goodness, you go back a long way. All the way from the check deposits by your doctors. Man, you do go back a long way. It's good to see you. I appreciate you joining us here. You can see that we've been around for well over 30 years. So good to have you here. All right. And then number 3 is extended training to get somebody up, especially if there's somebody brand new. And so these are just challenges. These are just staffing challenges that not just doctors face, but really anybody that's in business they face. So these are some of the things that create gaps. And the last thing a doctor needs is gaps in their billing. They don't need to hold their claims for 20, 30, 40, 50 days until they find somebody to actually do the billing for them. So, okay, if there are any questions so far, because we're going to move to number 3 here on compliance burden, but I just want to leave it here for a brief moment to see if there's any particular questions. I know that usually there's a question or two about, why would a doctor even want to hire somebody that's not maybe brand new, or you're brand new. Why would a doctor hire you? And I can help answer that for you if that question doesn't come up. But you've got 30 plus years of experience here with American Business Systems. I'm going to kind of just share a little bit and encourage you. If you didn't get a chance to watch Opie's interview from last week, she did not come from a healthcare background. She had no healthcare background. She's an engineer by trade, and she wanted to do something to secure her family. They had just moved from, or I think they live in Arizona. They lived in Arizona, and they wanted to move and get a little bit slower pace of life there. And so the medical billing was intriguing for her. She got it going. She joined a couple of B&I groups. She got out there and did what we told her to do. Look at those postings out there on Indeed, and if by the first 3 to 4, 6 months she didn't have a client already, and like I said, scheduling on getting her 3rd or 4th client pretty quickly. So again, if you haven't watched that webinar, I encourage you to go do that. I'm going to show you where to do that. Okay, well, here's Ebony. I have no medical billing experience, so I'm just taking it all in. Okay, so Ebony, maybe what I said helped you a little bit. So they got those little icons with the thumbs up or the hearts or anything. If what I'm saying, strikes a chord with you, just throw that out there so I know that I'm hitting, some of your questions and getting some of those answered for you. Okay, number 3. All right, so here's number 3. What are some top reasons why doctors need to outsource, or why? There's a thumbs up. Thank you. I appreciate that. Might be from Ebony. All right, so compliance. There are over 625 regulatory requirements. Healthcare providers must navigate hundreds of complex navigations across 9 domains. At any given time, there could end up being anywhere facing 734 large breaches in 2024. It affected over 276.8 million records. So folks, if y'all don't think HIPAA compliance is a big deal, you got to think twice. Let's just kind of take a quick journey here. Let's kind of take a mental trip here together with me. You go to the doctor's office. The first thing you do, you go to the girl up at the desk or the guy at the desk, And what do you see there? Well, if you haven't really noticed, there's typically sometimes a lot of open charts. There's driver's licenses that are laying around. There's insurance cards that are laying around. If you see one of those, or if you've ever seen one of those, and it wasn't yours, that doctor just violated a data breach. Yep. Yeah, and then even when you go back behind everything and you got doctor's records are all out and you end up in a doctor's office, and this has happened to us when we were taking my in-laws to the doctor. You pulled up on the screen, you walk in the room, and a different patient's information and all their information's up there showing just as plain as day. That has occurred. And the world's worst thing that has happened to doctors' offices is the invention of smartphones, because everybody in that office has one. They're on it they're on Facebook, they're on LinkedIn, they're on Indeed, they're on whatever they may be, taking snapshots of each other, because they've got a party going on or they want to share something online. And inevitably, a data breach happens. A piece of information of somebody's health records got snapshot and put up on Facebook. For HIPAA violations can cost anywhere from beginning $100 to $50,000 per incident for unknowing breaches. Those are those ones that I'm talking about. Unknown. You left a driver's license out. You left an insurance card out. Obviously you left out somebody's paperwork and you see what their diagnosis was. That wasn't you. You overheard them talking over there in the corner or whatever. They didn't secure all the data. That's for unknowing breaches. For willful negligence, penalties can just start off at 50,000 per violation. So there you go. So this is why I was sharing with you earlier. I know that you've come to the table here talking about healthcare and medical billing, but that's one of the services that we have amongst all of our services. The other one is that I'm talking to you about is the compliancy guard. So again, get with your sales rep here, learn a little bit more about that as you can do that. Now, I mentioned to you, you heard the word clawback earlier, so let me kind of tell you what clawbacks are. Clawbacks are whenever Medicare and or commercial insurances have overpaid. They've done an audit. They said, hey, we want to look at your charts. So let's say that you saw, 400 patients in a month's time. We want 20% of those charts. We want to look those over because we want to make sure that you're billing us correctly. So they'll do what's called a chart audit. And if they find out that the doctor has over coded, which means that they got more money back from Medicare or from one of the health insurance companies, and the doctor did not document that they spent 30 minutes or it didn't substantiate that higher reimbursement, they'll call that money back on the next claim that comes through. So just think about this. So let's just pick a name, a patient's name, John Smith. Okay, so let's say that on month one, Dr. Brown sees John Smith and charges Medicare for a very long visit, which is a 99215. Okay. And he comes back again for the second month because he needs to run some other tests, and he charges him again for a 99215, and then does it again for month 3 and does another 99215. Well, what happens is that Medicare, it flags it. They're going, okay, this doctor keeps billing John Smith for a 99215. It's the highest reimbursement that can happen. Okay. So they go, we want to see his records. They got opportunities to see what the doctor did, look at their doctor's notes. And if it didn't come up to a 99215, let's say it only showed that what the doctor did was equivalent to a 99213, then what they're going to do, they're going to say, we're going to take that money back on your next bill that you process, and then we're going to claw that money back. Okay, so that's what that means. So there's many different ways of what I'm sharing with you folks. Yes. Subrogation. Yeah. So yeah, it's Keyshore is saying the clawback is the same thing as just getting the money back. Okay. All right, so folks, you can see here that there's more ways doctors lose money. They may get the money, but it doesn't mean they're going to keep it all. Because if they go back and audit and the doctor's not substantiating that, that's why we have another service, and it's called Audit Guard, AUDIT, Audit Guard. And again, that might be another service you want to talk with your sales rep here. Because although that you're here again to become a medical billing revenue company or a medical revenue management company, and you're going to do medical billing, there are more aspects of revenue than just the billing. It's actually helping the doctor keep what they earn, whether it's through let's don't violate any HIPAA issues, doctor. Let's don't lose any money there. To let's make sure if you're going to bill a 99215, let's make sure that your documentation substantiates that code. Now they can do it. They just got to mark it down. And what an audit guard will do, audit guard can go in there and we can actually do that. And I did this with a lot of my doctors whenever I was doing billing. I would start them off. I said, look, what I want to do, I want to make sure that you're coding directly, doctor. So this audit's going to cost you X amount of dollars. But what it's going to do, it's going to ensure that it's going to put us all on a flat surface here as we kind of get some things going here. So that's what we want to do. We want to make sure that if you're billing certain things that we don't, and just in the reverse happens. If the doctors are overcoding and the insurance companies claw back money, it's the same thing if they're undercoding. They should be billing a higher code is what I'm trying to say here. So if there should be billing, their note says that they should be billing a higher code. Well, now let's put it out there. You know, a lot of doctors get scared because they see this clawed back money stuff and they hear overcoded. I don't want to overcode. I don't want to get penalized for all these clawbacks I hear from everybody. Okay, you get the picture here. All right. All right, folks, we've got just about less than 20 minutes left here. So if you got any questions here, now's a good time for you to throw those in there because we're going to quickly, we're going to number 5 here. 5 reasons why a doctor should outsource their billing, and one of them is technology. Folks, we know the rapid rise of artificial intelligence, automation in healthcare billing is changing the rules faster than most practices can even keep up. We talk about this as just new. We say this is a great disruption in the market. For those that have ever heard some older webinars with Patrick Phillips, Patrick always loved to talk about disruptions in the market. It's just new opportunities to do new things there. So new coding tools, AI-driven payer audits, automated claims scrubbing software requires ongoing training and software updates that are costly and time-consuming for in-house staff. Not with you. The great thing about it is, and again, this is where if you haven't seen the full demonstration of iClaim, you certainly going to want to get back with your sales rep and get a demonstration because we already have built in all the new coding tools. We've got AI-driven payer audits that are happening within inside of all of our systems here. But lest I lead you astray, I want to make sure you understand, because you're going to hear this even with Opie on her interview that she did last week. Even the doctors that she's doing billing for, she hasn't converted them over to iClaim yet, but she's getting them ready to, prepping them because eventually the current systems that they're currently using, because we're going to show you how to use the doctor's systems regardless. We're going to make sure that you are in business as a medical revenue management company with all of this new technology at the cusp and it's right at your fingertips. Belinda is asking, what are the services that you can offer? Well, again, one of them is obviously iClaim and EMRX. Okay, that is the billing practice management software and the electronic medical records platform. Then we have coding. There's two different codes services out there. The one's called CodeWrite, that if you need some coding expertise and the doctors need coding expertise, there's a service there for that. Audit Guard goes along with that because they do the audits on the background. We have the patient monitoring services. This is remote patient monitoring. This is an incredible service out there for that. The compliancy guard. We've got so many of this. That's just about half of what we've got there. So Miranda, if you haven't seen everything there on our website, again, get back with your sales rep. They'll be able to go through all the different services that you'll have. Okay, continue talking about technology. If I'll tell you this, if practices aren't keeping up with technology, they're already falling behind. And so it's already creating higher denial rates, compliancy gaps, and lost revenue. So we definitely know that. So outsourcing to a specialized billing team, which is somebody like yourself, they will always have experts who have already been trained on the latest technology without paying for it. That's the big thing. Even though that whenever you go to a doctor and you present yourself to a doctor, you're going to be able to share with the doctor, look, like Miranda was asking, what are my different services? Well, here they are. Here's a couple of them right here. Technology is burdens are lifted whenever we can get iClaim and EMRX in there. They're both streamlined. They both are AI powered now. It's a from the beginning to the end is beautiful of what's happening there for these doctors. Remember earlier I mentioned that it's taking up to sometimes 13 hours a week to do prior authorizations. Within iClaim alone, we can eliminate that as a problem. We have a way to check insurance eligibility and then not only check it to make sure that that patient is eligible to receive their insurance benefits, but while we're there, if we've never had the information, the patient demographics on that patient prior to that, that is an important part of we can capture that data directly from the insurance company and then pull it into the system. If you haven't seen that happen, again, I encourage you to get back with your sales rep and they can show that to you. Compliancy Guard is the one that I mentioned earlier. It's going to help simplify compliancy tracking. If there is a breach that happens, we're there to kind of help coach them along the way. So that's it there. So financial impact is improved revenue. So that's what we need to show these doctors. We're going to help you get there and help them understand, why a doctor would want to outsource their billing. Now, as I want to close up here this afternoon, I want to just kind of talk about why start with American Business Systems. We know that you're looking at several different opportunities out there in the franchise world and all these different ones out there. But I just want to share with you a couple of things. As I've already mentioned earlier, ABS was founded in 1994, folks. That's been over a 30-year track record and has had a proven success record since 1987. So it's been around for quite some time. And, it's as we look back could we've always done things differently? Of course we have. And that's what's made us even better. The other thing is for others that had mentioned earlier, you don't have any background in healthcare. You don't need any special degrees, professional license needed. Our software handles all the coding, so don't worry about that. Again, these are some of the things you should be learning from your sales rep here. And then the comprehensive training. You're going to have one-on-one live training with over 100 hours of continual training there afterwards. So you're going to have one-on-one time, just like what you're seeing me right now. You've got you and me. We're here, and you're at your house or your office. We're here. The only difference is that your microphone is already automatically muted. The only way we can communicate is through the questions and answer. But when you go through live training, we open up your microphone, so we have now engagement. And so you're going to have one-on-one training on 10 different modules. It's going to take you a little over about 20 plus hours to get all of that done, which is roughly about 2.5 weeks. If you heard Opie, and again, her interview or any of the interviews of anybody else that we've done here in the past, you'll certainly know that it's an incredible training. The financial potential is for your first year. I've got it kind of low balled here because and I would say this is a low ball because if you end up doing billing for a massage therapist or a small chiropractic group there, that's going to be $25,000 to $30,000 per doctor. But I can also tell you that if you did land Opie had an opportunity to take on an OBGYN clinic. Now, it was a little bit more than what she could bite off for right up the top. She did end up with a different OB, but I can tell you with that OB, she's making at least twice, if not three times, of what that is over there, as I'm showing you. But you can with usually this is what we say. Usually with one provider, wherever they're coming from, especially if it's a chiropractor or a licensed social worker or anybody else. If you have one or two of those, you're definitely going to get your return on investment within the first year. If you get a family doctor, just a regular primary care physician, you're going to get your return on investment within that first year. Obviously, it's home-based business. There's no commuting. You set your own schedule. You work from anywhere if you want to. That was one of the great things I kind of had Opie reiterate what she did there. She started her business in Arizona, has a doctor there in Arizona, and then the family ended up moving to Georgia. She still has her doctor back in Arizona that she's doing billing for, and she's picked up some new ones there in the Georgia area. So you talk about flexibility. There you can do that really well. We feel like this is about as recession proof as you can be because us guys that are over 60 years old, I'm reaching quickly to Medicare age myself. There's still 10,000 baby boomers turning 65 every day. This is a strong industry to be in. Healthcare will always be here. It'll be here longer than any of us will be around. So there's a one-time investment of $35,000, no ongoing royalty fees. There are no territories that you're going to have to keep up with. And all of our technology is all cloud-based. So you don't have to worry about loading servers or buying servers and trying to jump through all the hoops there on getting all that done.